This need for reform is also why we implemented the first ever long-term workforce plan described by the NHS CEO Amanda Pritchard as, and I quote, one of the most seminal moments in our 75-year history. Why is such an important and forward-looking reform missing from this report?
The first word the Shadow Secretary of State for Health and Social Care should have said was sorry.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance notice of his statement. The NHS belongs to us all, and we all care about it. So let's stop the political posturing and talk constructively about its future. We all know that our healthcare system faces significant pressures, as do all health systems around the world. We are living longer and with multiple and complex conditions. We have wider societal pressures, such as the impact of social media on the development of some young minds, as well as the treatment benefits that cost pressures of miracle drugs developed by our world-class life sciences sector. And the shock of the pandemic has had catastrophic impacts on the NHS and its productivity. Now, I believe there is much to be proud of in the NHS. Its dedicated staff look after 1.6 million people a day, 25% more people than in 2010. It has more doctors, more nurses and more investment than at any point in its history. It is delivering tens of millions more outpatient appointments and diagnostic tests and procedures for patients than in 2010. And of course, we delivered the fastest rollout of vaccination for COVID in the world, freeing our society more quickly than other countries. And we have more healthcare in the community, with the opening of 160 community diagnostic centres, the largest central cash investment in MRI and CT scanning capacity in the history of the NHS, as well as 15 new surgical hubs, and the launch of Pharmacy First, helping to free up to 10 million GP appointments with those living with more complex conditions. I would just say to the Secretary of State, I paid him the courtesy of listening to him in silence. I hope he would do the same to me. He was chuntering from a sedentary position. But we on this side...
Order. Can I just say, I want to hear the Honourable Lady. Your constituents also want what's being said. So please, let's give the same courtesies that I expected for the Secretary of State. Victoria Atkins.
Thank you, Mr. Speaker. Now, we on this side of the House have never pretended that everything was fixed. We haven't pretended that we have the monopoly on wisdom or that there are easy answers to the difficult challenges we face. For the NHS to thrive in its next 75 years, it needs to reform, modernise and improve productivity. This is why the Conservative government, working with NHS England, announced the NHS Productivity Plan at Spring Budget to transform how the NHS works through better IT systems for frontline staff, expansion of services on the NHS app, which is used by 3 out of 4 adults today in England, and the use of new technology, including voice-activated AI. Together, this would see productivity grow by 2% a year by the end of the decade and unlock £35 billion worth of savings. Yet it is not mentioned in the 163-page report. Why is such an important and forward-looking reform missing from this report? And can the Right Honourable Gentleman confirm that he is choosing to cancel it? A simple yes or no. New medicines and trials are an essential part of the productivity challenge. There is only one mention of NICE in the 163-page report. Again, does the government have a strategy for life sciences and the provision of rare medicines, including cancer and dementia drugs? And why have they paused the Childhood Cancer Task Force? This need for reform is also why we implemented the first ever long-term workforce plan with NHS in England to train even more doctors, nurses, midwives and other healthcare staff for the future. This plan was described by the NHS CEO Amanda Pritchard as, and I quote, one of the most seminal moments in our 75-year history. yet it is not mentioned in today's report. Again, why is such an important and forward-looking reform missing from this report? Is the Right Honourable Gentleman going to cancel the new places and forms of training, including apprenticeships, that were to be provided through that plan? The need to modernise is why in 2019 we announced the largest programme of hospital building in modern history, 40 new hospitals across England by 2030. I'd be careful for some of these backbench MPs. Today, 7 new hospitals have opened. The Midland Metropolitan will open at the end of the year, and I imagine the Right Honourable Gentleman will enjoy going to its launch. And a further 18 are in construction, and we're not even halfway through the decade. But since January 2023, it has been Labour's plan to pause, review, delay, and presumably, possibly cancel these new hospitals. They published their health mission then. It's on page 6 for those that haven't read it. In other words, this was always their plan to delay and possibly cancel new hospitals, and nothing to do with the Chancellor's questionable accounting since the general election. When this was pointed out in the general election campaign, Labour candidates ran around promising voters that their new local hospital or CDC was safe with them. In Torbay, Chelsea and Fulham, Basingstoke, Watford, Bracknell, Truro, Corby and Kettering, to name a few. Will the Right Honourable Gentleman confirm that Labour will delay these hospitals? And there is one... Forgive me.
It's difficult, but it's 5 minutes. It's now 6 minutes, 22 seconds. We're well over. Can we now conclude on that sentence? Thank you.
Very much. Thank you, Mr. Speaker. And there is one part of Great Britain where on almost every measure the NHS performs the worst. Labour-run Wales. The Right Honourable Gentleman has compared... I'm sorry. I meant you conclude now, not to continue with the rest of the speech. Secretary of State. No.
Thank you, Mr. Speaker. The first word the Shadow Secretary of State for Health and Social Care should have said was sorry. Yeah. She says she never pretended everything was fixed, and that's true, but it's about time that she admits that it was their party that broke the NHS in the first place. Yeah. In fact, it's been a feature of debate in this House since the general election that the party opposite has taken absolutely no responsibility whatsoever for the mess they left our country in. A £22 billion black hole, a new hospitals programme she refers to, where the timetables were a work of fiction and where the money ran out in March. She knew that. She knew that when she went to the country to claim that the programme was fully funded. She talks about the decisions made by NICE, a new Labour reform and modernisation, thankfully one that did survive the last 14 years. And you know, Mr. Speaker, she's endorsed the Right Honourable Member for Newark in the Conservative Party's leadership election. I wonder what she makes of his admission that the Conservatives failed to make the tough reforms the NHS needed because they were afraid of what Labour might say. Is that not the most derisory excuse for 14 years of neglect? Yeah. Mr. Speaker, my predecessor does not bear responsibility for everything in the Darzi report. This crisis was more than a decade in the making, but I wonder when she will show some humility on behalf of her party and apologise for the mess that her government made of our National Health Service. Otherwise, why should anyone trust what they have to say ever again? This government was given a mandate for change, and nowhere is that more needed than in our NHS. This report must mark the beginning of the long, hard work of change. It is the platform from which we will launch a decade of reform that will make sure the NHS can be there for us when we need it, for us, our children and our grandchildren. And, Mr. Speaker, in conclusion, it must draw a line in the sand so that we never go back to the pain, fear and misery the Conservative Party inflicted on millions of patients. Yeah.